All right, session 5. Can y'all believe we've been doing this 5 weeks? Session 5, February 24th. And here's what I think we need to finish. Do some more meds, finish diabetes, just a little bit more on cancer. We hadn't done orthopedics. I mean, there's nothing much. It'll take me 3 minutes to do orthopedics. We hadn't done orthopedics, have we? No. Okay. And I did want to say, I was reading about breakthrough, Elizabeth Hughes and diabetes, the discovery of insulin. And I had heard her father was vice president with Calvin Coolidge, but he was Secretary of State. Not that matters that much, but I would like to be honest. So, and I don't think, I read, I had always heard 44,000 shots. I read 43,000. So there were a few little things that, as I was reading, it was an abstract on breakthrough.
Did it also say that she cleansed her history? She didn't really want to be known for that.
Yes.
She tried to remove every bit of that.
I know she was embarrassed about her condition, which is odd. How'd you know that?
I watched the video this week.
Which ones you watch?
The 3 hour long.
Oh no, enough of Glory for Everybody. Isn't it wonderful?
It was really good.
Glory for Everyone. Was it on what? Net? Oh, okay.
It was like an IMDb or something.
Isn't it good? Who would think you would enjoy a discovery of insulin? But it really was good.
Another thing that was so baffling is that she had 3 children after being a type 1 diabetic.
Oh, and I didn't know that.
One of the first humans to get insulin and had all those shots. And she had 3 children.
Isn't that interesting? She is absolutely a poster child for how this was the crudest of the crude, and this woman lived to 70. I think that was another thing. I said 74. I think it's 73, but don't quibble. Yeah, so anyway, well, that's good y'all watched it. Now, just a little bit, let's just, while we're on it, just finish diabetes. We talked about rotation, and because the insulins are human-like, made in the labs now, we don't build up the hard spots, and so you don't need to rotate. And I told you about 1 inch, 2 inch each week out. At least get the pathway. They think helps a lot. Now, we're going to get, I think today, a little bit on hematology. And of course, it's on the YouTube, and Jennifer, you keep helping me. I hadn't watched it in a while, but we're going to get on it. But I've already told you once, but I just want to remind you that, the 3 cells of the blood, red, white, and platelets, and red lives the longest, 120 days, or 4 months. And so at the end of 3, the physician runs the H1AC, hemoglobin, or hydrated hemoglobin or something, I don't know. But it checks the clinging of sugar to the red cell. There's no getting around it. And the physicians, or the medical community says, if it's going to live 4 months, in 3 months, let me check how the sugar, how compliant the patient is about sugar, because the red cells, it'll stick on there. So, there's no cheating on that. It's just what it is. And then I really cannot, but it's, I love for diabetics to watch carb counts. And Mandy, you all watch them. I know when you said your son. Yeah. And I have when I nurse on the Lookout Mountain with this nurse I've been with for about 10 years. She is a pediatric nurse, and which you do diabetes with everything. But she said, you love carb counting more than anybody I know. And I do, because I think it makes you more normal. to be able to eat something sweet. And used to diabetics, so they couldn't eat sweets. And it was at least now, if you watch your carb counting. So what am I talking about? If you don't know, and chime in, Mandy, if you want to, on carb counting, a normal woman, a carb serving is 15 grams. That's one carb serving. And so how many do I need a day? Well, a dietitian could quiz you and you tell your habits. I'm athletic, or I always exercise every day, or whatever. And the dietitian would tell you, then your lifestyle needs about 2 carbs each meal, and 1 carb for a snack in the morning and a snack in the night. So now you can eat fat and you can eat protein, but carbs, keep it about 2 each meal and 1 snack. For a man, usually, I'm giving you the general, 2 for you and me is good. A diabetic woman, that would probably be fine. A man, 4, 4, 4, breakfast, lunch, and supper. 15, 15, 15, 15. And a snack mid-morning, a snack mid-afternoon. And you get where that exercise, you pick up something and turn it over and look at the servings. And you have to be so careful, because when you turn it over, my eyes go straight. I'm not diabetic, but I do watch carbs. I think everybody needs to watch carbs. But I'll turn it, and the first thing I look for is total carbs. In this business that I'm about to imbibe, what total carbs? And it may say 30. Then that means there's my 2 for that meal. And so if I'm going to have that drink or whatever it is, that's all the carbs I really should have. But the trick is the beverage, the companies, the food industry trick us in a way, because you must, if you look at total carbs, you must look at the very top, and they'll say there's 2 servings in here. So the whole thing is 60. And so you really do need to be real prudent how many servings is in this, because the total carb is 1 serving they're talking about. So that can be misleading if you're not on top of it. Subtract, after I look at total carbs, drop your eyes down to fiber, and you can subtract the fiber from, maybe it was 18 grams of carbs, which means I'm a little over 1 serving. Oh, but I had 2 carbs, and that dropped it down. You subtract the carbs from the total, the fiber from the total carbs. And that way, I think a diabetic is not so hands-off of anything that's sweet, that's legal. They may have some fat and protein in a diet, but I like to look at foods to see how many carbs are in them. And I looked at ice cream on a stick, and some of the, like Purity, any of them, they're not as bad as you think, and it's 1 carb. So a diabetic could have ice cream for dessert, and that's their 1 carb. They may have had another one with potatoes or French fries or something. I just like carb counting. Do you want to say anything else about carb counting?
I mean, it really is the key to life for anybody with diabetes, because it's just moving carbs in terms of sugar. But, you know, it's kind of, I mean, so many of us are, whether it's active keto or low carb, I mean, pretty much now that there are all these low carb diets, it's not as, you can figure out ways to
Yeah.
make things. And for us, we just found some good sweeteners, like different stevias,
Uh-huh.
tall kind of.
Which stevia is the the favorite, I think, because it is, if you're familiar, stevia is the plant. So and if you get it at Whole Foods, it's glister. If you look on the bottle, it's brown with a medicine dropper, but it's brown because it's photosensitive. But it says glycerin and the plant, and so there's no chemicals in it. Now they have stevia at the grocery stores, but they're in the dried packages, and that's all right. But they've been processed. If you want the real, it's just glycerin and the flour and a drop, and you begin to learn, and it's just not chemicals.
The only other thing I was going to say, I mean, just for her, and I guess if you're treating somebody with diabetes, or for my daughter, if she's going to eat something sweet, have a treat of some kind, it's just better to anchor it with protein. Like she's going to
Yes,
have
yes.
a couple cookies or something, because like yesterday was my other daughter's birthday. We're still in like major party mode, cousins are at the house. I bought that horrible Charlotte's caramel pie. 'Cause my daughter, I mean, it's just straight
Sugar.
awful, and sugar, and, but it's like if Olivia, my one with type 1, she's gonna have that, like actually like the boar's head, salami sliced really thin. I always have a bunch of that, or we have turkey, just some good meats, and she'll have a couple rolls of turkey or a couple pieces of salami.
That's
Just
good.
There's that, so it's not just.
Well, and I'm glad you said that. This dietitian I know, I may have told you, she says chase those carbs with protein. Protein will chase them and try to detonate them.
And didn't you, that brings up a question that I had about carbs. I thought I remembered you saying something about berries. Eating berries
Yes,
and that
yes.
carbs.
That's what she said as well.
And I was just curious, maybe one of you will know, like, when you eat a lot of fruits and vegetables, there are some carbs
Oh, yeah.
in those.
Oh, yeah.
How do you, because not everything has
No.
the nutritional value on it. How do you
You know,
keep
I
up
mean,
with those?
like if Olivia's gonna have mango, that's full of carbs, you know,
Yeah.
so, we definitely count that, like I chop it up and measure it in a cup or whatever.
Banana is
Banana, but there's still great nutritional value in
Yeah,
the banana.
yeah. And the fiber in the fruit.
But like if she's having some fresh strawberries or raspberries or frozen blueberries and something, I don't make it a big deal
No.
of that. Like,
This dietitian on berries eat as much as she wants, is what she says.
She doesn't count them.
Now, grapes, a different story.
grapes are 1 carb correct, so Olivia's having 10 grapes.
Yeah.
10.
I know 7, 17. Well, I don't know, but 10, and that's a whole carb serving. No, maybe it's 7 lifesavers is a carb, but.
I would say with diabetes, like other moms that I talk with, sister type 1, like when people are like, what's the one piece of advice or one thing that you've really had to cut out? And we just, our main thing that we've said no to is drinks. Because if you're
Yes, yes,
soda or juice or
yes.
whatever, it's just, you've got to measure it. Like, you can't just, and then if I measure a cup of orange juice, and I'm like, okay, give yourself 30 carbs, but you didn't drink it all. Plus, juice, there's no fiber in it.
No.
It just goes, it's just straight
Yeah,
sugar.
yeah.
So, like, we always drink these Zevia,
Mhm.
sodas. Like,
And
it's
this
just
says,
flavored with
is that
Zevia.
just, is that
So,
stevia? Uh-huh.
but I mean, I think
That's a
if you
good
really
piece of
wanna go on
advice.
the no sugar and eat that way, the only way it's really ever going to taste good is to not eat sugar. Like if you're trying to eat sugar and doing stevia, stevia is always going to taste weird and have that like funky. But if you do cut out sugar, after a while, desserts and drinks that are flavored with stevia, you start to like it. But you can't ever really.
Mm-hmm.
You know what I'm saying?
That's
Like,
a good
really
point.
wanted it other was sweet. So that's just right.
This, I'm going to refer to this article in a minute, but if they say pour 1 inch of juice and the rest carbonation, or, no carb, bubbly kind of stuff. If you just love carbonated food or drinks, that's one thing to do. is, but it's best water and then get sugar someplace
My
else.
kids all like iced tea. I mean, I think we have one kid with a family of six, it's like, I just gotta do the same thing for everybody.
Mhm.
So I just buy like, either I make iced tea, or if I'm really in a hurry, like the Kroger brand iced tea, the unsweetened Kroger
Mhm,
brand, because
mhm.
of caffeine.
Yeah.
So I just
Oh,
pour
yeah.
that in a big
Oh,
gallon,
yeah.
and I sweeten it with stevia, and everybody
Oh,
likes
yeah,
it.
yeah, yeah,
So
that's good.
That's just how we.
Yeah. Let's see, and I thought of something else when you were telling, oh, I think one of the worst things we all do, I have to stop. Well, no, I'm pretty good now after all this life. As I said, I'm not diabetic, but when bowls of candy and the little candies, people just eat them, just standing and visiting with you. Well, they're a carb each. And you know, I can hardly visit for thinking you've just eaten 5 of those. And that was a whole meal for a man, more than a meal. And so that's being so mindful. And of course, Mandy's family has to be mindful, but being so mindful of just not eating and talking, you know, buffet, those, or cocktail parties or whatever, and people just stand and visit. Well, what are they doing? You know, you have to think about that. But to answer you, Jonna, fruits, Jonna, Brooke, yeah, you knew. Let's see, something I wanted to say on that. Oh, the fruits. My diabetic friend who works with him says he calls grapes nature's trash food, because he says it's skin around sugar, a grape. And it is my least, I think it's one of the least to eat is grapes. Banana is not considered great. But yes, you have to count half a grapefruit is a carb serving. You have to do it. But the berries are, they, according to people, is one of the best, and you don't even need to count them.
Have you heard of there's a new, I think it's called Swerve?
Yeah.
It's wonderful.
What is it?
It's called Swerve, and
It's Wichita.
I only noticed it because this woman was in Publix 2 days ago buying all of it. And somebody said something to her, and she said, I'm a diabetic, and this is going, and it tastes like sugar, it measures like sugar.
Yeah.
You can get the granulated or the
It's
powdered
different
sugar.
foods. There's this really fun website called All Day I Dream About Food. And the lady got gestational diabetes with pregnancy, and it just never went away after she had her babies. And so she's just like a type 1 sugar at home.
Yeah.
But she loves food. And so her recipes are not easy, I don't think, today. But she uses Swerve for all her desserts.
Now, why have I never heard of this?
She's got every kind of food. It's good.
Spell it for me.
Swerve, and it says the ingredients are derived from fruits and vegetables. But it doesn't affect the diabetes.
SWERVE.
Swerve.
Why have
It
I
does
never?
not affect the glycemic index.
It's just like stevia and xylitol and erythritol.
Okay.
You do have to be careful with the xylitol because it will kill your dog. Yeah.
Oh,
It's a very
okay.
poisonous dog.
Oh, okay.
Or XY, xylitol. I mean, it tastes more like sugar. It measures like sugar,
Mhm.
but it might, I don't know if it's in Swerve or not, but it's
Oh my goodness.
xylitol.
And Swerve is everywhere. I mean, grocery store.
And you can get it online.
Oh,
Yeah,
yeah.
you can get it online.
Yeah. Okay, well, we learned that. See, I learned from y'all. The insulins, we've talked, they're on your card that you have, and the thing is, those that the one that starts, if you want to follow in your briefs, we could look at that, and if you don't have your card with you, go to medicines, go to about page 20. It might be there. Let me see. Are they the insulins? Yeah. No, 19 are the insulins. And that's not all of them by any means. But briefs, you see Novolog, Humalog, Lispro, Aspart, they start, I tell students, memorize the 5 minutes. They will start in 5 minutes, so the rule is the food needs to be right in front of you. Because if that brain doesn't get sugar, it dies and never to come back. I mean, you are gone. That's why it's a scary thing and it needs to be taken seriously, given these insulins. Peaks in an hour, I always remember 2, and then it's over in 4. I think it's easy to remember. 5 minutes, 2, and 4. Regular insulin starts in a half hour, it peaks in 4 and through in 8. MPH climbs, it gets there in about 2 hours starting, 12 hours peaks, 24 length. Now, the next 2 are ones that they take about an hour or 2 to climb, and then they stay there for 24 hours. Stay at that level, and it doesn't say 24, but it should. Ultra lenti, that's just, you'd learn that. I mean, you don't go around memorizing that. There's some that are mixed. You see 70-30, Novolog 70-30, and they're just a mix of the insulins. And all those that go 24 hours, they need a snack because they're going to go to sleep for 6 to 8 hours with no sugar. And but the insulin is in the bloodstream with no sugar and will have brain damage. I always say there are not many absolutes in this profession, but I have never nursed at night that a diabetic isn't asleep when they're at a 24-hour insulin-dependent diabetic, that they'll be sleeping and their graham cracker and milk has come to the nurse's station for them. They're asleep. I have never not shaken them and said, your snack's here. Up, and turns the light on. They are ready because they are so hypoglycemic because their insulin's still staying in them as good as ever for 24 hours. There are others, but those are some of the main ones. Latimer, Latimer and Lantus are the ones that climb and just have no peak. They just stay. Then I wanted to tell you, and I tell it because I think it's a good way to keep insulin and diabetes in mind. I've told you I refer to it off and on the camp where I nurse and have for about 30-something years. And I think I told you my boys went, and it was barter. I wasn't paid. When they quit, then I got paid for what a two weeks for a boy would go. And the first year I was there, I was the only nurse. There were about 160 to 180 boys, and it'd always just been one nurse. And I did fine. They just come up for what they need if you were on scheduled drugs. But the second year I was there, the second year I was there, opening day, the mother brought me her diabetic son's medicines or insulin, and she said she would leave some dietetic, which brings up the dietetic foods. They're expensive, and you just do better so often just to do sugar. Don't you? I want to read some. I've got it here to remind you. I want to talk about sugar versus the diabetic foods. Unless it's...
You mean like diet, like aspartame stuff?
And people think it's safe, and it used to be that was what they had. Now we know I can just watch my carbs, and I don't need dietetic stuff. Anyway, she left dietetic things at the canteen, and registration morning, she was real proud. I think he had been with me the first year and did fine, but it tells you how long ago, 30 years ago, I guess. He was pricked, so we've been just pricking our finger about 30 years, because until then you did urine, glycosuria, and checked urine for sugar. And they say now, when we prick the finger to get the sugar count, it would have taken 2 hours for that to have been processed into urine. So that's how ahead of us the whole blood glucose is. So she told me, she showed me the stuff, and it wasn't that I didn't know how to do it, but it was new to the medical community 30 years ago. So she left, and the next morning he was to come by for his insulin shot, and I was to do a blood sugar, but it was not his amount of insulin was not contingent on his blood sugar. It wasn't sliding scale. If it's this, give this much insulin. So it wasn't. They just wanted a record of his blood sugars in the morning. And he came upstairs. The clinic was upstairs in the lodge, and he said he was whining, and he said he was sick, and said he'd been vomiting. And so I did his blood sugar. It was 33. Well, I knew you don't give insulin with a 33. And so I knew that I shouldn't give insulin. And he said he was just so thirsty. And I thought, his blood sugar's low. I don't care. I'm going to give him I'm not even going to give him caffeine and a Coca-Cola. I'll give him 7-Up. But I knew better than to let him guzzle. And so I said, James, I'm going to give you a little cup, which was 30 milliliter medicine cup. I said, about every 15 minutes, I'm just going to give you that, because I figured it would be just good. So we did that for every 15 minutes until the 7-Up was over. It took 2.5 hours to do it. And he just laid on a Chase lounge. And we finally got it in, and I was very proud. And I said, James, I want you just to lay here a little while, and I'll come back in a minute. And again, I say there are not many absolutes, but when I walked away, this sound of vomitus on a hardwood floor, you know exactly what it is. And so he regurgitated the entire 7-Up. He's worn out, I'm worn out. He does have a flank pain in his flank. And so I know now now I could handle it differently 30 years ago. But then I called her to tell her. I told her what. She said, how much insulin have you given him? I said, oh, I hadn't given him any. His blood sugar was 33. She said, oh, brother. Well, that hurt my feelings. And oh, brother. She said, and she wasn't scolding me, but she said, we need to get him. And she wasn't reactionary. She did not, oh my God. She didn't do any of that. She said, we need to get him to a doctor. And so the nearest was Fort Payne, Alabama, 17 miles away. So she said, I'll meet y'all there. It was about a 2-hour drive for her. But she wasn't alarmed. She did not act upset. So we get in the car to go to the emergency room, and I talked to myself, not him. I said, she's not a nurse. She said, no, you don't give insulin at a 33. But another voice said to me, she's had a diabetic son for 3 years. She knows what she's doing. But you don't give insulin at 33. So I always embellish the story to say when we had to go into the emergency room because it was late in the afternoon. And I embellished by saying I slammed the door in his face to get in there and ask the doctor if I did right. But that's not the way it was. We walked in together. And I told the physician what was going on. I said, his mother wanted me, thinks I should have given insulin. The doctor said, Oh, I sure wouldn't have. I said, oh, okay. I didn't. But I'm worn out with him. He's worn out. And they do anything. He wants something to drink. And so they give him any water. They gave him water. But they also put a pan beside him. And sure enough, as soon as he drank the water, he vomited. And they did his blood sugar, and it was 580. And the fella hadn't eaten it all. And then it hit me. And it was really one of the best lessons for putting the classroom into practice. Because I already had my master's. I did it at Vanderbilt. And I remember in physiology, she taught it, but I didn't practice it. And that was gluconeogenesis, where your sugar is stored in the liver, and so it's stored there. But if I starve my muscles, then the body will give me, if I'm not going to take sugar in, which he wasn't, then the liver will, and the liver lets go to try to go in, but it still can't go if you don't give it insulin. And so that's why his blood sugar was climbing. His flank pain was the liver pouring out sugar. And let me say, what would you do any different? Oh my, I can't even believe I didn't, but I didn't. And that is, you take his blood sugar again. Especially when he tells you he's hurting. Then it's, so what I should have done is, in a little while, taken it again, and I would have seen it was going up. Now, I'm not going to guess at how much insulin to give him, but I could have called his pediatrician and said, here's the story, how much insulin. The physician really needs to do that guesswork on the insulin, as far as when you don't know your child. But now, and a diabetic knows themselves, and they kind of know how much they need to take and all. So anyway, he stayed that night, but came back to camp and did fine. But the mother sent him to a diabetic camp after that. But you know, the deal was, because I didn't give him insulin, we didn't kill any brain cells. That was the best part of the story, is that no insulin was given to kill the brain cells. But what it says is, remember, just because we don't eat, doesn't mean the blood sugar isn't going up. And so the muscles were crying. What was wrong with him? I think he had a bug and vomited, and then his electrolytes are off, so the muscles need sugar, and he's not taking any in. And even if he did, which he did with me, and in an hour and 2 hours and a half, I'm sure it was building up blood sugar in the bloodstream, but the muscles still weren't getting it because of no insulin. That's the reason she said, how much insulin have you? No, she wouldn't have given insulin at 33. But what she knew is it needed to be checked again and then insulin given then. Because the muscles were getting no fuel. And so, because he wasn't getting insulin, the liver kept pouring it out. Well, okay, I'll try to give you some. But it didn't do us any good because it couldn't get over to the muscle.
That's happened to us. I mean, in the 8 years since Olivia's had it, I'd say maybe five or so times when the flu bug or the throw-up bug goes around with poor kids.
Oh,
Because
yeah.
so I'm always like quarantining her. I think the thing to remember is if you're trying to treat somebody with type 1, once they throw up, you just got to be in high alert because that she starts making ketones. So the first thing I do is I check her urine and see if she's got ketones going, and then I call Vanderbilt, and they kind of put me on a schedule. The same thing, it's like, okay, get her to drink a sugary drink, get insulin in her, and I try to work with them.
Oh, yeah.
And probably out of those 5 times, I know twice, maybe 3, I don't know, you just finally have to give in and go to the ER, because once she gets a bag of fluid, she's magically better. I can't do it at home if she's vomiting and
and we hadn't talked about ketones, but it's fat being broken down for energy. If you're not going to give me sugar, then I'll.
It's hard to figure out.
Uh-huh.
I mean, I'm a nurse and have this
Yeah.
type 1, but it's
What an illness.
It's hard to figure that out. Once people start throwing up, like we have friends or family, anybody with family throwing up. I mean, I don't care if it's a fever and coughing or anything, but if there's a throw up, I'm like, don't come near us.
Yes, just because of that.
It's like she gets in the negative. If I can't keep up with it,
Right.
like she gets too backward, out of
Yeah.
balance, out of
No.
balance.
Yes, the out of balance.
You can't get her back by yourself. You've got to just take her and get her back with it.
Isn't that something?
Yeah.
Yeah. So I think all that's important. I wanted to read you a couple of things, and I think you probably already know them. We've talked about some of them. And this was 2011, so this is 8 years ago. In the U.S., a new case of diabetes is diagnosed every 30 seconds in the U.S. And, but this, type 2 anyway, they say a UCLA study found 50% of patients with type 2 were able to reverse it in 3 weeks with dietary changes and exercise. But you really have to be good. And then they tell you how to do that. Eliminate corn syrup. I just am not a big twirler of the hand on corn syrup. Now, if it's glaring on a label and says none or high fructose, I won't. But I'm not big on, not going to touch it. Now, I did quit Fig Newtons because they are nothing. You can, and the other day in the store, I wanted Fig Newtons so bad. I thought, well, let me go to the diabetic. I didn't want them with stevia. I didn't want them artificial. I just wanted figs.
Paul Newton.
Is his good? Well, I got some. Terrible. They are terrible. I don't know if I can get through them or not. But because I saw Fig Newtons are high in fructose, the corn syrup. And the reason they say it's not good, and I fought it for so long, tried to defend corn syrup, because I said to myself, it's sugar. I mean, corn makes sugar. And so what's wrong with that? Well, the calories from corn syrup fail to trigger leptin, Leptin, the hormone that tells your body to quit eating. And so consequently, people gain weight and then they're diabetes, or they might go into diabetes. Also, fructose is more likely than natural sugar to be converted to fat. So I'm not as high on watching that, but I think it's a good thing to try to start doing. Don't drink diet sodas, and I think we've talked about that. But diet sodas actually cause weight gain by boosting insulin production. It makes insulin produce more, leading to excessively high insulin in your bloodstream that triggers greater fat accumulation and even more cravings for sugar. And I'm not a barley, but they say I know they say natural is so good for us without all the processed. This article says meat is good because it's protein, but the trouble is a lot of the processed. They don't want processed because it's high sodium. And then they say the very best. Now, oatmeal, they like oatmeal. One of the best slow carb for digestion. Kind of does what those shots do we've talked about. That slow GI digestion. But barley, they say, is the absolute best. And that even keep it in the refrigerator, this article said, sprinkle it over your salads. Just always have it to throw it into something. And I haven't done that, but I think it sounds good. And then, of course, we've heard cinnamon. And they say 1/4 of a teaspoon a day will help diabetics or keep you from diabetes. I think that's all I'm going to say on diabetes unless Mandy has something.
I'm sorry.
No, keep on.
I wanted to share one last thing about Thursday. I took Olivia, we spent a while at Vanderbilt because she got the CGM put in her. So it stands for continuous glucose monitor. So she wears her insulin pump, and then now she has this thing. We've tried a couple before, it didn't work well, but this is the top of the line. It's called Guardian. Like somehow we got some of this and we're able to get it. But it's amazing because she can look at her pump. She wears a pump up to her hand. She can see what her blood sugar is without pricking her finger. So it checks her blood sugar every 5 minutes.
Let me tell us
So
the name.
The little catheter, I mean, it's just a little, you know, it's on her arm, here on her arm, her belly. She's got a thing called whatever, but she's got it on her arm, and it just looks like a, I don't know if y'all seen people in the summer at the pool with them. I've seen people working out with them, but just a thing with a big tegar on it right here, and it lasts for a week.
And
it tests the interstitial fluid rather than blood. So still a finger stick is more accurate, but this is great to not have to
tell me, it's called what now?
C like Charlie, G, E, CGM, continuous glucose monitor. And there's several out. This is called
And-
Guardian, there's the Dexcom, the Dexcom is nice because it was linked to my phone. So I could be right here and she could be in Brentwood and I could call my husband and go, Olivia's 250 and rising, go see what she's doing. But the Dexcom will get in line. She didn't like it. So now we're trying this Guardian. It doesn't have the phone capabilities. But this was the interesting thing, the nurse at Vanderbilt who we've known forever, and she's had type 1 since she was a kid. She said, Mandy, you gotta get Olivia to like this because this is the way of the world with diabetes. The meters and the finger sticks are not, they're going out. Everybody's gonna have to wear these CGMs.
Right.
So
Oh,
I
that's-
can't imagine that, but that's what they said. And
Isn't
I
that
know
great
that-
to hear this?
so
This is
in the
just
8 years since Libby's had diabetes, they're constantly telling us, like, there's a cure coming, blah, blah. But the CGM, when we started, we knew a few people who had it, but our doctors at Vanderbilt, they're like, it's not really, it's approved, we don't know if we trust it. So they were real skeptical about it. Now, they're pushing, and they're like, so they've gone from skeptical,
Uh-huh.
in 8 years, they've gone from really skeptical to like trying to get everybody on it because they're like, this is changing people's lives.
that is so good to know, and I'm glad you brought up on the pump because it's been a slow process to get the pump. Now,
It's amazing, but I can't imagine that.
now it'll check her blood sugar. Then she has to give her injection.
But, right,
At this
so the
point
pump is
with
giving
this.
her insulin. She has to put in, like, say she, you know.
Now
say she
they're
needs
not.
a,
Are they the patch on the arm?
patch on the arm is the CGM.
Megan, it's CGM, continuous glucose monitoring, made by Guardian.
Her pump goes into another site, which she likes to run her hip.
So her pump is at another site.
Yeah.
This is reading her blood sugar
This is
only.
blood sugar only.
Constant.
The thing that this does, like right now we're in manual mode. We'll go back
Uh-huh.
a week or so. And they want us to get comfortable with it, and then they want to put us in auto mode.
Okay.
Manual mode, all it's doing right now is checking her blood sugar every 5 minutes.
Oh.
And if she starts to go low, it has these arrows. Like 1 arrow means she's just sore. 2 is, you need to do something. 3 is like it's just going like
It stays on how long?
a week.
A
This
week.
does, you gotta change the sign.
And
It
now,
shuts off her basal rate, so she's getting a basal rate every hour. So if she's going low, the CGM tells her pump, shut down the basal. And then like in the night last night, we had a sleepover with my other daughter's birthday, and the girls were like, Olivia's thing was alarming all night. Because they eat that stupid O'Charlie's pie. And so all through the night, her CGM is making her pump beat going, you're high, you're going higher, you're going to give yourself insulin. So the girls are like, wake up, Olivia, give yourself insulin.
yeah. So does she have a button on the
On
pump to give her?
So the pump says you're 250, and then she hits a button for bolus. and
What
give herself-
what kind of insulin is she fast, or what kind of insulin is she?
She's just on Humalog.
Humalog. So she does 5 minutes. I mean, it reacts immediately almost.
Oh,
5
yeah,
minutes.
she didn't, I mean, that's what the company wrapped up a
Yeah.
lot. Atlantis and all that stuff.
Yeah.
That was when we were
Yeah.
doing shots, which were awful.
Yeah.
So, I mean, a lot of kids and people just don't want stuff stuck on them, and I get that, but, I mean, you've got girls, like, the famous thing, like, girls when it's prom time, they want to wear some super tight dress, have to figure out a way to stick their tongue in their cleavage, or they'll go a day or two and do shots. They don't
Crazy.
want to have a
Yeah.
It's like Olivia, like sometimes she will, she's 14 and she just falls and then she wants to wear some tight little thing, but she's like, well, it's, you know, it sticks out, you know, it's chunky.
Sure.
So whatever.
Yeah,
I mean, but
yeah.
I just thought that was amazing.
No, thank you so much.
For
I
us,
meant
these
to.
last few days to be able to just look at it, and we are still pricking our finger and checking to go. Like the other day, I'm like, well, your meter says 130, but this is saying like 110, so it's still
Just not
be
quite.
calibrated.
And that's
Should-
interstitial versus
Yeah.
blood. Yeah.
So with the CGM, supposed diabetes, you still have to calibrate it like every 12 hours, because they don't, the FDA won't approve that you treat on just this. It's complicated.
Crazy.
But
Yeah.
I think it's getting better and better, and I think it's gonna help. with the
Yeah.
disease.
They've made a lot of advances. All right, let's go now. We'll quit that on that. I want you to go to briefs, to medication. Let's do a little bit more there. Get that out of the way. Where now? Are y'all good at telling me the page? I think it was insulin. I think that's where we ended. Page 19 in the briefs, insulin, and we've already gone over them. Don't worry about IV drip meds. There's your KCL runs. We did talk about that, didn't we? That 10 milliequivalents is all the heart can stand in an hour. And but PO is really better than IV, but we've got to get it in fast, so we use an IV. Keflex is PO antibiotic. Lasix, furosemide or diuretic. Levaquin, give PO solution. You should turn a feeding pump off 1 hour before giving the med and turn it on 1 hour after the med, because it's not to be given with food. I think it's not as potent. Lidoderm, topical anesthetic. Lithium, it's used for bipolar or mania. And lorazepam is Ativan. Drug withdrawal. Oh no, we've still got pages. Microdantin is urinary anti-infective, not antibiotic, but anti-infective. If used over 6 months, can cause lung fibroids. Magnesium. If potassium is low, IV magnesium can sometimes be ordered along with supplemental IV potassium. When both IV and a lot of times the physician sees the low potassium and wants magnesium too. Even though it doesn't show that it's going low, they have such a relationship that the physician will order both. And they tell us that they want us to, when both IV are ordered together, always give the magnesium first. I guess it has more of a relationship with potassium than potassium does with it. Meprigan is a combination of Demerol and Phenergan. And then sodium chloride. Narcotics, we know they love to scale of 0 to 10. Nebsen is tobramycin, and it will not mix with anything. Tobramycin. And there we've already talked about Numega and Neupogen being for the sub-Q injection for platelets and white cells. Neurotin, you all who were just with us, and Piola was going to give her gadapentin. anticonvulsive, and they do, it's a controlled substance. And they give it for pain. It really is for neuralgia, but that is pain. So nitro paste, the thing I tell students, wipe the skin with an alcohol to get oil off so that it really does penetrate the skin. And you put it on, a lot of times saran wrap is put over it. And we've already talked about Affirma, IV Tylenol, oxycodone, oral morphine. Percocet is acetaminophen and oxycodone. Phenergan, I think we've already talked about it. I've really seen a change in that. In the old days, IV pushed 25 milligrams IV push. And now you are be hard pressed to ever be ordered to give 25 IV. They now send us 6.25 in a 50 milliliter bag and have us give it over 15 minutes. It's like a secondary. Why? They just said that it was too much for people, and especially elderly, to give them that much Phenergan. And you know what it is. I mean, it's an antihistamine, or for a lot of times given to enhance a narcotic or to for nausea. But the biggest thing about it, it does need diluting, and good dilution, because it just people tell me it's like a deep bone pain. If anybody's had any IV potassium. Well, what about putting some lidocaine with it? Well, it's not worth that. Maybe KCL, they do a little bit of that, but if it stings, it's probably burning the vein, which makes it scar. So just because lidocaine, it's still going to scar veins. So that's not the answer to everything. Piperacillin decreases its potassium. And we've talked about potassium already. And Lyrica, anticonvulsant, used a lot in the nowadays for pain, neuralgia, or neuropathies. Procardius sublingual, under the tongue. And I'm not sure if we went over it. You know, it says a gelatinous pill contains contents squeezed out. Calcium channel blocker, decreases blood pressure. And I can't remember, so I'll just repeat it and y'all can just stare at me if I've already told you. But here it is, and it is gelatinous. It's kind of like old chlorohydrate. And nurses in the past just take scissors and snip the end of the capsule, and with gloves squeeze it out under your tongue, open mouth, and squeeze it. And a student rotated one time with me, rotated to the unit, and she said, well, one good thing I learned how to give Procardia sublingual without getting it all over gloves, because it's still hard for it to all get under the tongue. And I think it's very clever. Here's your capsule, and you're looking at a side view. You take a syringe and put air in it, and then make the syringe go all the way through the capsule to the other side, then bring it back and leave it on the tip end of the needle and go in to the patient's room and say, now, it looks peculiar. You've got a syringe with the tip end a pill, and you say, I'm just going to squirt it in your mouth. So open your mouth, and you just, and you've got that air that just clears it out, puts it under the tongue. It's really clever and works so well, and you don't have it all over everything. Pyridium, used for urinary tract infection. It's palliative, not a cure, and it does turn urine orange. So let's just whip on. We've done most of these. Reglan, and it's old, and it's still being used, and is liked. Used for increased gastric motility. The IV form is photosensitive, so do not give when a patient has a. And I think we talked about pheochromat. Did we? Pheochromatomas. There, it's on the endocrine movie, YouTube. It's a benign tumor. I can't remember if we talked about it, but I know I told you, here are your kidneys. The adrenal glands sit on them like a little cap. And pheochromatoma is a benign tumor that is only in the adrenal glands. And it causes high hypertension. And I'll talk more about it when we do endocrine. The thing is, if you've got a pheochromatoma, your blood pressure is sky high, and Reglan's side effect is hypertension. So it's just kind of a rule that Reglan is never given for nausea to a person who has a pheochromatoma. Runs fast, so you do not have to keep a brown bag over it while infusing. Relistor, oh, that's an interesting one. Used for narcotic-induced constipation, administer sub-Q. And I don't see it used much. I'm going to have to ask somebody. Oh, it got real popular about 3 or 4 years, maybe 3 years ago. And I haven't seen it given lately. And it's for narcotic-induced constipation. And what you do is, they're just so constipated. Now, this is what pharmacy came up and talked to me about it because we were going to give it, and it was kind of new then, a couple of 3 years ago. He said, get them on that bedside commode before you give it, and it's sub-Q. And you give it sub-Q, he said, in 5 minutes they'll defecate. And he said, if they don't, then give them another one. And I think you can give 2 to 3. And, but it will make them defecate. Sub-Q. Sandostatin is used for fistulas or heavy secretions, and it's sub-Q. And sandostatin is a enzyme that the pancreas produces too. I think it's pancreas. But it is, if somebody has a wound that is so superous and it's so hard to heal, they may give them some sandostatin, which helps with that. Senokot stool stimulant. Senokot S both softens and stimulates. Solumedrol. I'll try to bring one when we do our clinical decision day. It's not that, I mean, you see one, you'll know how to do it. Push cap down. And remember, rolling mixes best if you've got a measure. You can just shake the daylights out of it, but it makes foam. And it's hard to measure if you've got to draw up something. And everybody, all have years thought, we roll insulin. They thought it really did something to destroy it. The only reason you roll insulin is so the suds, you've got to be accurate. And if you shake it, then it makes suds and you can't be accurate. That's the only reason. We've already talked steroids. And Tegretol is anticonvulsant. Also treated for facial pain. There's tetracyclines. Avoid milk or calcium-containing products. Wait 3 hours. If you think you took some milk products, at least wait 3 hours before taking the drugs. And then Thorazine can be used for hiccups. Uracid is anti-infective. It's palliative for urinary tract infection. And the side effects of it are blue-green urine. And now it does some good where Pyridium at the bottom of 20 is just makes you feel better, but doesn't do anything to make you feel better. Uracid will really work on the anti-infective part. Valium, diazepam, very thick, toxic to veins, and is used for alcohol withdrawal. There's your Victoza, which is your anti-diabetic injection. It's similar to Byetta. Vitamin C, and I think we've already talked about it, helps absorb iron. Vitamin D prevents and treats renal bone disease. And you know, they now fortify with vitamin D. Oh, that's something here. Listen to this on this diabetes. A Flemish study found that participants with a high level of vitamin D were 40% less likely to develop diabetes than those with lower amounts. Vitamin D appears to improve insulin sensitivity and reduce the risk for diabetic-related complications. How much? This says recommended take 1,000 international units to 2,000 daily. That's what that says. Warfarin, which is Coumadin, and you monitor their clotting. Therapeutic used to be about 2.5 to 3 times your normal, but it's about 1.5 to 2. That was what's realistic. The physician, the books may say 2.5 to 3, but a physician, when it starts getting up about 2 times what it was normal, they begin to stop it. And there's Xarelto that we've already talked about. The emergency drugs are there: epinephrine, amiodarone. Not nearly as many as we used to use in cardiac failure. It's really down to just these: atropine, magnesium, amiodarone, and epinephrine. And if you were going to work a unit, you would be interested in that. Now, why don't you take a quick little break and come back here. And Megan, we're going to stop